Plaque control refers to the process of removing microbial plaque from the surfaces of teeth and the adjacent gums. The main aim is to prevent the accumulation of this sticky film, which, if left undisturbed, can lead to oral health issues. By practicing effective plaque control, we not only keep our teeth clean, but also protect the surrounding gum tissue. This foundational step is essential for anyone who wants to maintain a healthy mouth and a confident smile. In the following scenes, we'll explore why plaque control is so important and how it fits into your daily oral care routine. The goals of plaque control go beyond just having clean teeth. By regularly removing plaque, we can slow down the formation of calculus, which is hardened plaque that can only be removed by professionals. Effective plaque control also helps resolve gingival inflammation, keeping your gums healthy and free from swelling or bleeding. Ultimately, these efforts preserve your overall oral health, ensuring your teeth and gums remain strong and functional for years to come. Let's see how these goals connect to the prevention of more serious dental problems. Regular plaque removal is crucial for preventing both gingival and periodontal diseases. When plaque is not removed, it can harden into calculus and harbor harmful bacteria. Over time, undisturbed plaque above the gum line can migrate below the gums, where it becomes even more dangerous. This subgingival plaque is a breeding ground for pathogenic bacteria, which can cause inflammation, infection, and even tooth loss. By understanding this process, we can appreciate the importance of daily plaque control in maintaining a healthy, functional dentition. Mechanical plaque control involves physically removing plaque from the teeth and gums. This can be done individually, using tools like toothbrushes, toothpaste, and interdental aids such as floss or interdental brushes. Professional mechanical methods include scaling and root planing, which are performed by dental hygienists or dentists. These techniques are essential for reaching areas that are difficult to clean at home and for removing hardened deposits that regular brushing can't tackle. Next, we'll look at chemical approaches that complement mechanical cleaning. Chemical plaque control uses antimicrobial agents to reduce or inhibit plaque formation. These can be used at home or applied professionally. Common agents include chlorhexidine, phenols, and quaternary ammonium compounds. Mouthwashes and rinses containing these chemicals can help control bacteria, especially in areas that are hard to reach with a toothbrush or floss. However, chemical methods should always be used as a supplement to, not a replacement for, mechanical cleaning. Let's now discuss how to choose the right toothbrush for effective plaque control. Selecting the right manual toothbrush is key to effective plaque removal. Toothbrushes are classified based on bristle nature, hardness, shank design, and whether they are intended for adults or children. The right toothbrush should fit comfortably in your hand and mouth, allowing you to reach all areas easily. Bristle hardness is especially important, as it affects both cleaning efficiency and gum safety. In the next scenes, we'll break down the recommendations for different bristle textures and their specific uses. Extra soft bristles are recommended for people with tender gums or those prone to bleeding. These bristles are gentle and minimize trauma to sensitive tissues. Soft bristles are ideal for younger children, as their gums and teeth are still developing and require a delicate touch. Using the right bristle texture helps ensure effective cleaning without causing unnecessary irritation or damage. Next, we'll look at medium and hard bristle recommendations. Medium bristles are the most commonly recommended for the general population. They strike a balance between effective plaque removal and safety for the gums. Hard bristles, on the other hand, are reserved for special cases, such as individuals with heavily keratinized gums or those who require more forceful brushing. However, hard bristles can increase the risk of gum recession and tooth abrasion if used improperly. Let's also touch on why extra hard bristles are rarely suggested. Extra hard bristles are rarely recommended by dental professionals. While they may seem effective at removing stubborn deposits, they can actually cause significant damage to both teeth and gums. The risk of gum recession and enamel abrasion is much higher, with extra hard bristles making them unsuitable for most people. It's always best to choose a toothbrush that cleans effectively without harming your oral tissues. Now, let's move on to the various brushing techniques that can maximize plaque removal. The Bass method is a widely recommended brushing technique for effective plaque removal. To perform this method, hold the toothbrush at a 4-5 degree angle to the long axis of the tooth, with the bristles gently placed into the gum sulcus. Use short, vibratory, back and forth strokes to dislodge plaque from the gum line and tooth surfaces. This technique is especially effective for cleaning below the gum line, where plaque tends to accumulate. Let's see how the modified Bass method builds on this approach. The modified Bass method is similar to the original Bass technique, but adds an extra step for enhanced cleaning. After performing the vibratory motion with the bristles in the sulcus, sweep the bristles occlusally toward the biting surface of the tooth. This sweeping action helps remove loosened plaque and debris from the gum line. The modified Bass method is especially helpful for people who want to ensure thorough cleaning along the gum margin. Next, we'll explore the Stillman's method and its unique features. Stillman's method is another effective brushing technique, especially for those with specific gum concerns. To use this method, position the toothbrush at a 4-5 degree angle so that the bristles rest partly on the gums and partly on the cervical area of the tooth. Use a vibratory, rotary motion to massage the gums and clean the tooth surfaces. This method is particularly beneficial for stimulating the gums and is often recommended for people with gingival recession. Let's see how the modified Stillman's method builds on this approach. The modified Stillman's method builds on the original by adding a sweeping motion after the vibratory, rotary strokes. After massaging the gums and cleaning the cervical area, sweep the bristles toward the crown of the tooth. This technique is especially recommended for individuals with gingival recession, as it helps clean exposed root surfaces while minimizing trauma. Using this method can improve gum health and prevent further recession. Next, we'll look at Charter's method and its special uses. Charter's method is designed for people with specific gum concerns, such as receded interdental papillae or those needing gingival massage. In this technique, the bristles are pointed toward the crown of the tooth at a 4-5 degree angle. The motion helps stimulate the gums and clean areas that are often missed by other methods. Charter's method is especially useful for patients with orthodontic appliances or after periodontal surgery. Let's move on to the roll method, also known as the phones technique. The roll method, also known as the phones technique, is a simple and effective brushing method. To perform this technique, direct the bristles apically toward the gum line and then sweep them in an occlusal direction, following the shape of the tooth. This rolling motion helps remove plaque from the gum line and tooth surfaces. The phones technique is easy to learn and is often recommended for children or those with limited dexterity. Finally, let's discuss the scrub technique and why it's generally discouraged. The scrub technique involves a simple back and forth scrubbing motion. While it may seem straightforward, this method is often discouraged by dental professionals. The vigorous motion can cause abrasion of the tooth enamel and recession of the gums over time. This increases the risk of sensitivity and other oral health problems. It's important to choose a brushing technique that is both effective and gentle on your teeth and gums. By following the recommended methods, you can maintain a healthy smile for life.